The ProACT Know-How, brought to you by ProACT.
Hi, this is ProACT Sam from Living and Working Abroad, ProACTPartnership.com. We help EU expats living and working abroad in the UK, Europe and Cyprus make the best decisions to protect their family and business living and working abroad, relocating overseas or investing offshore. And we're particularly interested with our clients that are based in Cyprus at the moment with the impact of the new National Health Service system in Cyprus. Now this is a healthy change for expats because there was a very limited health system, national health system in Cyprus up until 2019. All the local, or majority of the local private practitioners have been rolled into a new national health system for Cyprus, which has been rolled out in 2019. Registration starts in April, payments start from March 2019, the actual service delivery starts in June 19, and by the 1st of June 2020 designed to be fully implemented. If only things were as simple as that. As we've seen with Brexit, things can be delayed. When an EU expat goes to any country, they can transfer their social insurance from one country to another depending upon their circumstances. A retired expat living in from any EU country can move to another EU country and get a Form S1, which allows their home country to pay their entitled National Health Service to their new tax resident country. Working expats have got the freedom of movement as EU citizens throughout the EU to live and work in any other EU country. And obviously by both methods, the expats can then qualify for the local national health system. Now in Cyprus in the past, this has meant that people relocating to Cyprus to live and work, in fact, don't get any access to healthcare for 3 years. And this is something that needs to be borne in mind. So still a large reliance upon private medical insurance, at least at the onset. But if you are paying in to the Cyprus healthcare system, social insurance system, then you'll be able to qualify for this new national health system. So anybody that's been paying social insurance for more than 3 years as an expat living and working in Cyprus can now qualify for to be a member of the health system in Cyprus. Now you compare that to a country like Cyprus, where like the UK, where once you become any EU citizen that becomes resident has full access to the NHS, which is free at a point of consultation and treatment. There's prescription contributions, but a lot of the treatments are free in the UK. It's not the same for every country. So in Cyprus, once you qualify for the system, the actual costs for the users of the system are not high. There are some treatment costs, which we'll cover later in this video, but at the outset, the effective point of interface between the patient and the health system is relatively low cost. There is a contribution that has to be made, and that's in proportion. Again, we'll come to that later. What I wanted to cover first is if you qualify for the scheme, and that for Cyprus is 3 years working social insurance contributions so far. There's a bit of conflict and because what has been introduced is a new national insurance tax payable by people in Cyprus. So social insurance contributions for employees and employers are going up in 2009 by a total of 1%. So an employee with a total of the employee and the employer's contribution is rising to 16.6%. in addition to that, the employer can also pay another over 8% towards holiday pay, which the employee can reclaim each year. So many people are still members of that scheme. The alternative is that the employer in Cyprus, if an expat comes to Cyprus to create a company and become an employer, they either pay that additional 8% employer contribution to social insurance to make a total of nearly 25%, or they give the equivalent holiday leave, paid holiday leave to the employees, which is effectively means more than a month, about four or 5 weeks. The self-employed social insurance rate in Cyprus is 14.6%, so it's about the same as the self-employed. And that doesn't change, and that has to be continued to be paid. However, in addition to that now, there is a national health insurance tax as well, and it is distinct from social insurance for working in Cyprus, but it can be paid. So if an employer is paying social insurance, then he is obligated, she is obligated, the employer is obligated to pay the national health insurance contribution into the scheme at the same time. So it is separate, but it's paid in the same way and administered by the social insurance department to get the money into the national health fund. Again, there is an employer and an employee contribution. So initially the employer will be paying 1.85% and the employee 1.7%, but that will rise to 2.9 and 2.65% in total. So by 2020, the employment cost of national health insurance is an additional 5.55% for employers and employees. So the employers have to pay some of that tax. Now, employers and employees are going to have to get together. Is the employer going to bear that full cost of that extra tax for the employees, or will they renegotiate contracts, or will they carry on an existing arrangement where the employee has national insurance tax deducted from their pay? So this is something that each individual employee and employer needs to work out in the coming months, because the payments towards national health insurance are paid with social insurance from the 1st of March 2019. The initial contribution is 3.5% in 2019 and then 5.5% in 2020. Those figures of 1.7 and 2.65 are important, and I'll come back to those in a moment. Self-employed people pay quarterly in Cyprus. They have to pay a bit more, but not so much as an overall employer-employee package, 2.55% and 4%. Of course, the catch in Cyprus is that they can put you on a fixed income for your trade, which often means you can be paying a disproportionate amount against your actual income that you're receiving. The point about those charges are that the national health tax is not just payable for employment. So social insurance is paid by anybody that's living and working in Cyprus. So all EU expats that come to Cyprus have to pay that social insurance tax. However, the new national health insurance is paid by all Cyprus tax residents. So if you're not employed, how do you pay the national health insurance? We're working that out. The system still isn't in place because the Cyprus tax system is all online and payments can be made, but it's a fragmented system because there's a prescribed way to do it, and that system is not always open and freely available to allow people to pay as it goes through its teething problems over the last year. However, with your 2019 tax return, not your 2018, with your 2019 tax return, anybody who's not employed but who is a pensioner or has investment income from rentals, from bank interest or from dividends, who's a Cyprus tax resident, has national health insurance tax to pay. Now, a non-domicile might say, no, I pay 0% tax on dividends and bank interest, and that is correct. But this national health insurance doesn't come under that remit. As things stand at the moment, in the second quarter of 2019, the national health insurance levy is paid on all pension income, on all rental income, and on all bank interest and all dividend income of any Cyprus tax resident. And that means their worldwide income is what should be declared in this day of exchange of information. If you want to know more about getting your 2019 Cyprus tax return done, contact us at ProACTPartnership.com. Go to our website and you can send us an inquiry form or email us at info@ProACTPartnership.com. However, there is a bit more, because not only does it affect tax residents and expat tax residents, even if they're not working, that they're paying it on pensions, rent, bank interest and dividends. If the expat is not a tax resident, if they're just got an investment base through their trust company or their offshore company based in Cyprus, but they're not actually personally a tax resident in Cyprus, they still have a liability to pay national health insurance tax on their pension, on their interest and their dividends that arise in Cyprus. I said that the wrong way around. On the pension and rental income that arise in Cyprus. So if the non-tax resident is earning interest and dividends abroad, that's okay. But if it's got pension and rent interest arising in the UK, arising in Cyprus, then that is subject to the national health insurance tax in Cyprus. Even if they're not a tax resident, that income arising in the Cyprus still attracts a tax liability. If you want to find out more, contact us at ProACTPartnership.com, and if you've got a question, email it to us or contact us at our Living and Working Abroad page on Facebook, and we'll try to answer your question and get to the bottom of this. There's still some things that need to be clarified. We know, for example, that people have S1s that transfer their EU medical cover to Cyprus. However, as things stand, there's a bit of a conflict, and the rules at the moment in quarter two of 2019 say that expats still need to pay the national health insurance tax with their 2019 returns, even if they don't pay tax on pensions and other investment income at the moment. Let us have your questions, let's have your queries, join in the conversation at our Living and Working Abroad page and group, and we'll speak to you again next time. Thank you.
The ProACT Know-How, brought to you by ProACT.